just like cancer changed our lives, Dr. Flanagan changed our lives in her approach to Lauren's care, uh, her approach. I had never been exposed to palliative care before learning what palliative care meant. And I talked to Dan about this. What did Dr. Flanagan mean to us? And he said she was the first doctor to treat Lauren and not her cancer.
I'm Erin Flanagan. I'm a pediatric palliative care physician, and I had the honor of caring for Lauren Graver from the beginning of her journey all the way until the end. And there's so much about Lauren and her family and their journey that is rich to discuss. But what stood out for me at the very beginning was how beautifully Amy and Dan advocated for Lauren and empowered her to advocate for herself in a way that was extraordinary from the very start. And for me, there was the initial clinical aspect of her care that needed immediate attention. That was getting her pain under control. And that was, in my mind, always the first and foremost goal before you can really embark on learning what that child is all about, what that family is all about. Nothing is that you see is real until a child's out of pain or their symptoms are controlled. And so I think so often in our work, that therapeutic alliance starts when families see that you can do that. That there's often so much fear in being aggressive about getting a child's pain and symptoms under control for many different reasons. But having the experience and the comfort with the medications and the interventions necessary to get her out of pain and in a space where she could feel herself, that's where I felt like we could really start our relationship. And so to me, that was the thing that stands out about meeting Amy and Dan and meeting Lauren, was that it took a day or so, and then it's like we could exhale. And then
you got to know the real her. I remember thinking that the cancer the diagnosis was so devastating, but then I felt that no one was listening. Like you could see her writhing in pain on her hospital couch. And I asked for pain meds. I asked her nurses. I asked the residents. I asked the oncology team, and no one would give her anything stronger than Tylenol. And I was like, this can't be. Like, I've had C-sections. I know there's some stuff out there. This can't be. And then I don't know, somebody said you're going to see a palliative doctor. I really did not know what that meant. And Erin walked in, and we had been cautioned about pain meds because they were afraid Lauren would get, opioid addiction. And Erin said, we're going to take care of it. I think within hours, for sure within 24 hours, I had my daughter back. And then I could talk to her about how we were going to deal with this. There's so much fear, so much confusion, so much worry, and she's a gifted warrior, really gifted warrior. And just getting that pain under control, it brought her back. And then it didn't make it normal, but it made it bearable to see her not in pain.